Hi, I'm Sam Johnson. I'm a third year here at the College of Nursing, and some of my research interests include vulnerable populations, addiction, and psychiatric disorders. Um, those two, like specific vulnerable populations, I got a lot of experience with growing up, and I also just generally want to be able to work with populations who kind of have a bit of a broken trust with the healthcare system and helping to bridge that gap and kind of give them some confidence and someone in healthcare that they can look to as a good example, and that there are people working to improve things and problems in the system. um, I decided to just choose two of Dr. Bach's articles since I've already been matched with her. They were both about correctional nurses, and I have almost no experience with incarcerated individuals, present or past. So I'm excited to explore something that is fairly new to me, but is still transferable to the populations that I would want to study uh, in my own career. I also know she works a lot with social determinants of health, and I'm a big believer in the ubiquity of intersectionality. I think nothing with people ever exists in a vacuum. There's always a web of social factors that are influencing it. So I'm excited to work with someone who has that same vision, I guess. The first study I chose was Modeling Wellbeing for U.S. Correctional Nurses, a cross sectional study published earlier this month. And it was looking at how stress and support in the correctional nurses' jobs affects their well being with a focus on those social determinants. There were 270 nurses that completed a cross sectional online survey. Um, they found a direct relationship between the job stress and demands and control and the nurses' well being, as well as their relationships, mostly in the workplace. And they also found that that stress kind of mediates the demand and the control with the nurses' well being, which I think is a fairly logical outcome. I think it's about what you would expect. One of the big things that it mentioned as like why this is important is that it kind of creates a target for how we can improve that work environment and the nurses' health and morale. Shows us what specifically we could look at to improve. I also liked that it had kind of a big breakdown of some of the percentages of the different demographics. 69.8% female, 56.8% white, 15.4% black, and then smaller numbers of Asian, Hispanic, Pacific Islander. The average age was 40.4 years, which for some reason in my mind I expected to be lower. So that was kind of interesting. I also couldn't stop thinking about how much harassment nurses see. I think it's something like 96% of nurses in general report some sort of history of harassment, physical or verbal or sexual, from patients and family members. And I would imagine it would be even worse in a correctional facility. So that was just kind of something that I was connecting to previous knowledge. I also read the other article was Unsafe and Unsettling, an integrative review on correctional nursing, work environments, and stressors. One cool thing that I noticed reading this was published about a year before the first article, and it kind of had a lot of building blocks for what they studied in the other article, which I thought was kind of cool the way they linked up. Uh, they looked at 11 different articles on stressors and burnout factors in correctional nurses, found the key themes of conflict, fear, and demands, which again, I think is logical. And they found that correctional nurses need more outside evaluation of health and well being, need more resources to reduce stress and policies to mitigate ethics and violence, uh, which I think, what was I going to say? Oh, I think that makes a lot of sense. You see nurses that work in like an ICU where a lot of patients pass. They need more, like counseling. So it makes sense that that kind of transfers over to correctional nurses who are seeing a lot more violence than I think a lot of other uh, fields of nursing.